Ben Winslow explains how lawmakers are hoping to rein in the power of public health orders. Ben.
The bill has been the subject of intense negotiations here on Capitol Hill because it sets limits on what the governor can or can't do in a state of emergency. Critics say it's inserting politics into public health.
And we're almost a year into this pandemic emergency.
In response to Utah's COVID-19 health orders, Senate leaders are introducing a bill that sets limits on what the governor can do in a state of emergency.
Every power and order that the executive branch and the health department have been using are legislative powers. The legislature has allowed them to use those, so I think it's appropriate that the legislature would have oversight.
It stems from a very public spat between legislative leadership and then Governor Gary Herbert. When they refused to extend his COVID-19 state of emergency, he let it expire. Then he issued a new one every 30 days. The bill requires the governor to notify the legislature before a state of emergency is issued. It gives lawmakers the power to terminate or extend a state of emergency or public health order, but also allows for public hearings. It also cuts the fines for violations of public health orders like those Utah County parties we've seen. It gives counties similar powers and limits the power of stay-at-home orders. Lawmakers have fought the governor over mask mandates and some COVID-related restrictions.
Yes, I had some disagreements with some of those, but quite frankly, Monday morning quarterbacking this, I think that they did what they felt was appropriate.
Public health groups have expressed concerns about the bill. The Utah Academy of Family Physicians says it worries politicians are inserting themselves into scientifically based public health decisions and that sound decisions will be up to the whims of political influence. Governor Spencer Cox's office tells Fox 13 it's working with the legislature to find the right balance and policy.
We'd have the political consequences of ignoring health department recommendations. But again, we haven't taken them totally away.
Senate Democrats were also involved in negotiations and support the bill.
I think this bill will provide transparency and allow for people to engage, and the public they feel that they haven't been able to be engaged fully.
Now, given that the Senate Majority Leader is sponsoring the bill, it is expected to be fast-tracked and moved through the legislature pretty easily. On the Hill, Ben Winslow, Fox 13 News, Utah.